Welcome to my presentation, Stimulation in Education, at Pecha Kucha. My name is Suzanne Clark, and I am an assistant instructor in the MedLab Science program at BCIT. The 2009 emergency landing of Flight A320 in New York's Hudson River and the successful rescue of all 150 passengers was not the result of some divine intervention. It was because of the many hours of simulation the flight crew had been put through prior. What is simulation? It is defined as the act of imitating the behavior of a physical system, such as an event, situation, or process. Simulation technology is proliferating in education because the products used in the technologies are becoming more affordable and accessible. Simulation is not a new learning or training methodology. The use of cadavers in surgical skills labs likely go back thousands of years. Actors are used to imitate patients in objective clinical exams for med school admission, and multi-million-dollar flight simulators provide virtual environments for student pilots. So why simulate for learning? Well, apart from the obvious risk to human life and capital investment, there is a push from all types of employers to teach beyond the transfer of knowledge and assess for broader competencies more rigorously. It is said that expert proficiency requires 1,000 hours of supervised practice. This amount of time is not practical in the real world, therefore simulation technology helps shorten the training period. Most importantly, it provides a safe learning environment for practice and confidence building. Educators always hope that the knowledge and skills used in the classroom will transfer to situations in the real world. Today, there are two types of simulation technology that are gaining popularity and are known to correlate well with real-world outcomes. One type of simulation uses technology based on virtual reality, known as VRS. This technology combines real instruments such as surgical or dental with virtual reality environments. Web-based computer games such as Second Life also fall into this category. Computer-controlled mannequins are used to teach basic physiology and management of medical scenarios. This sim mom responds to several types of interventions and is great for team-based learning where competencies such as communication skills and teamwork are developed. Simulation, whether of the high-tech variety or not, provides educators the opportunity to assess how well the student has learned the skills, especially for a regulated industry. Mastery of the skills implies competence, which establishes a trust that our lives are in good hands. For the rest of my presentation, I'd like to tell you about my competency-based course in which a student spends 4 hours per week in a clinical microbiology lab. Although there are no high-tech virtual simulators, the format simulates the work done in a real-world microbiology lab. What does a microbiology technologist do? Many of you have probably sent a specimen to a lab when your doctor suspects a bladder or eye infection. The microbiology technologist sets up biochemical tests to identify the bacteria and includes susceptibility tests to determine which antibiotic to prescribe. Because this course has a lot of credit hours, we have 2 lead instructors, 2 lab instructors, and 1 lab assistant supporting the course. Combine the cost of manpower with cost of supplies, and you can see how expensive it is to offer a program that has 5 other similar courses to this one. We cannot get real specimens for the students to analyze. Real patient specimens must first be analyzed by an accredited lab, and patient confidentiality limits our ability to get these specimens after the real testing. In addition, the quality of the specimen is not good after days of storage at the real lab. So if we can't give students the real thing, we have to simulate or fake the patient specimens. Bacteria are like people in that they don't always behave as you'd like them to, so about 4 hours of prior testing is required for every lab to ensure the simulated cultures look realistic for the students. To prepare the simulated specimens, bacteria on this plate are put into liquid, which is used to make multiple copies of culture plates for 80 students. Although this sounds like a quick procedure, it can take up to 8 hours to make all the culture plates for 80 students. To identify the bacteria on their plates, the students get to practice with the same tools and supplies while following the same standardized procedures as those in the real world. While they are encouraged to work independently to gain confidence, any collaboration encourages a team philosophy. There are 2 instructors in the lab with 20 students, not an ideal ratio considering how hands-on the labs are. After demonstrating the tasks to small groups, the students proceed on their own, whilst instructors observe and provide on-the-spot feedback regarding technique, documentation, and lab safety. As it is a competency-based program, the students are required to demonstrate their level of skill. This nerve-wracking lab exam occurs twice per term, and they have to achieve a minimum of 60%. Because they've had lots of opportunity to practice, the level of anxiety due to stress is lessened. Upon successful completion of the 3 didactic terms, students continue development of their knowledge and practical skills in a 42-week practicum at a hospital or private lab. Because the students arrive with all the basic knowledge and skills, the busy clinical preceptors don't have to spend time teaching the basics. We all hear about how difficult it is for new grads to get into jobs because they lack experience. Co-ops, practicums, internships, and simulation will be built into more types of courses, including the liberal arts, as support for competency-based education gains momentum. I hope you now have an appreciation of incorporating simulation into any type of learning. I'd like to thank my coworkers and students for allowing me to take their photos, and I want to thank you for watching my very first Pecha Kucha.